satellite clinics, there is a worldwide shortage of qualified healthcare professionals. How are these facilities going to be, or where are the resources to man these facilities? How are these facilities going to be manned? Granted that, you know, the plans are still on the drawing board and so on.
That's a welcomed question. I wanted to indicate at Southside the day before yesterday on Monday, 3,500 square footprint is what we're contemplating. A triage system will be involved in this footprint of services. It will involve at least one physician, not more than one, a triage nurse or a nurse practitioner, an expert involved in radiology. Thank you, Minister, and a receptionist, someone to help man. So those are the 4 personnel that will man these facilities. I think by the time 2008 rolls around, with the wonderful support that we're receiving from Curon, helping us with the management process of our recruitment at the Bermuda Hospitals Board, we'll face no challenges with staffing these facilities. The staffing requirements are actually modest. The impact is huge, and we look forward to experiencing no difficulties with providing triage nurses and physicians. The physicians, plainly, I contemplate and anticipate will be our local doctors. And we will deal with the hours of opening so that it is a facility that does not compete with practitioners. It's open at times when practitioners have closed their doors for the day.
But even the KEMH, the acute care hospital, they're constantly complaining about a shortage of staff, a shortage of nurses. Nurses are working overtime and so on, double shifts and the like. Shortage of physicians. So even with Curon and these other people on board assisting with that effort. So I still don't understand, you know.
I'm at a loss to understand why you're having such difficulty with comprehending
because there is a shortage of...
No, it's an assertion that you make, but...
No, it's not an assertion. It is a fact that there is a shortage, and we've constantly heard that from the Board of King Edward Hospital.
You may take your information from wherever you take it, but if you're going to depend on the information from the Minister of Health, I'm aware of all of the challenges that we have with recruiting nurses, and certainly physicians. I'm certainly not aware of any challenges we have for key doctors in our healthcare system. As for the nursing issue, I've been dealing with it on a periodic basis. We have no challenges with recruiting nurses. We've got excellent support from Curon to assist us with getting our nursing staff in place. And again, I repeat that by 2008, with this effort continuing to appropriately resource resource staff at the professional level of nurses, I have little doubt that we'll be able to meet the requirements of these 2 urgent care centers.
You see that there is no difficulty in acquiring professional staff. It took the hospital more than a year to get a new oncologist. What was the reason for that?
That very issue of the oncologist to which you refer was pre the Curon assistance that we had. That's my very direct answer to that. I came into the ministry and faced that issue. We have made extraordinary progress with the assistance of our recruiting efforts at the hospital these days. And so if you continue to dwell in old news and old situations, then you'll continue to have a misimpression. It's one I'd like to disabuse you of.
So you're saying that there is no that the hospital won't have any problem at all in acquiring or recruiting staff?
This is the standard to which we work. We must work towards achieving successful objectives and successful ends.
Minister, what about rest homes for the elderly? I know there was a definite problem a few months ago with getting enough nursing staff for those in the new home. So they were saying, you know, we can't actually fill all the places there are because we don't have enough nurses to deal with the people.
I'm not sure whether I've made this statement publicly or not in recent statements, but that issue was one that challenged us. I remember the current opposition spokesman, Mrs. Jackson, saying this as far back as when the House was in session. And because of the challenge, I've addressed it. And again, Curon have assisted us. We have no less than 14 nurses lined up to help us with this very issue of both Sylvia Richardson and Leaf Roy, and any upgraded seniors' homes or seniors' residences that come online. And we will continue to use these kinds of options to help us with our HR in this area. So that's an area that we have, I'm happy to say, happily begun to address. And it's going to continue to need a vigilant eye to keep up with the demand, particularly with continuing care, as we look for ways to ensure that our population moving into continuing care have professional help.
Are those nurses, the 14, they're coming from the States then?
They are, in fact.
Yeah.
Curon is a U.S. Organization.
Yeah.
They're searching and fishing where they best can locate this kind of professional staffing.
There has
Absolutely.
been a suggestion that even though Bermuda has managed to control its HIV/AIDS rates, and in fact those numbers are declining, there is a certain degree of discrimination that people afflicted with the ailment continue to face in terms of getting employment and in fact even housing. How do you as Minister of Health plan to address that?
Robustly. As soon as these issues of any issue of discrimination are brought to my attention, they have both a legal dynamic, they have a health dynamic. I'm happily and both able to deal with both of these roles, and therefore I'm sensitive to them and alive to them. I'm not aware of any particular cases, and that's why I began to turn to Minister Midas to see if she would wish to
Just
to
last
comment.
evening we interviewed the lady from STAR, I think it's called, and she said quite bluntly that discrimination is the biggest problem that people living with HIV and AIDS face in this country in terms of getting employment, in terms of finding housing.
Then my earlier answer applies. Once I'm made aware of it, once the government is made aware of it, this is a government that will respond to these challenges, which do arise. I don't deny that they exist in Bermuda or globally, because this is a common feature associated with people suffering with HIV and AIDS. I'd be most interested to have anyone who has this particular issue to raise it with the government and with myself specifically as Minister of Health.
Hasn't been brought to your attention?